I'm just doing my rounds. Is there anything I can get you before I head out? All right, rest well.
The hospital patient who officially never existed. A man was treated in a hospital, spoke with doctors, signed medical forms, and then vanished, because according to every official record, he was never there. Hospitals are among the most heavily documented places on Earth. Every patient is logged, every wristband scanned, every movement recorded. Names go into systems, vitals are charted, prescriptions are tracked. So when staff at a metropolitan hospital realized that a patient they had treated for nearly 48 hours did not exist in any database, it triggered an internal investigation that quietly ended without resolution. No press release, no public report, only testimonies from medical professionals and a paper trail that led nowhere. This is the documented case of a hospital patient who officially never existed. On a Tuesday evening in early spring, emergency services transported a man to the hospital after he was found semi-conscious near a bus terminal. He was approximately in his mid-30s, well-groomed, no signs of homelessness, no visible injuries other than mild abrasions. When asked for his name, he hesitated, then provided one. Hospital protocol began immediately. He was admitted, vitals taken, blood drawn. A temporary patient ID was generated. Several nurses later recalled something unusual. The man spoke calmly, clearly, but seemed confused about basic personal information. Not panicked, not distressed, just uncertain, as if the answers were missing rather than forgotten. He asked one question repeatedly. "Can you tell me what year this is?" Initial tests showed nothing alarming. Normal heart rhythm, no drugs in his system, no head trauma. But doctors noticed anomalies in his neurological responses. He could recall complex facts, historical events, technical details, even obscure trivia, yet could not remember where he was born, where he lived, or how he arrived at the bus terminal. One physician described it as selective amnesia without a medical cause. The man remained cooperative. He signed consent forms, spoke with staff, even joked lightly with a nurse during the night shift. Nothing about him felt unreal, except one thing. His patient wristband failed to scan properly. The barcode existed, the printer log confirmed it had been created, but when staff attempted to pull his file digitally, the system returned an error. At first, this was dismissed as a technical glitch. Hospitals experience system issues all the time. A temporary paper file was opened. By morning, IT was notified. That's when the situation escalated. The patient's name did not appear in the hospital database, not under admissions, not under emergency intake, not under temporary IDs. IT attempted to regenerate the file manually. The system refused. One technician later stated that the database behaved as if the patient entry had never been created, despite multiple logs showing staff interactions tied to that ID. Meanwhile, the patient remained in his room, alive, alert, present. Over the next 24 hours, at least 9 staff members interacted with the patient: 2 nurses, 3 doctors, a radiology technician, a hospital social worker, and 2 administrative staff. All remembered him, all described him consistently, same appearance, same voice, same calm demeanor. The social worker attempted to locate next of kin. No results. No government records matched the name, date of birth, or physical description provided. Fingerprints were requested. That's when another anomaly occurred. The fingerprint scanner returned no match, not unusual in its own, but when compared against national databases, the prints produced an abnormal response. Not "no record found," but "data structure invalid," a phrase technicians later said they had never seen before, as if the system didn't recognize the data as belonging to a human fingerprint at all. When informed that records couldn't be found, the patient did not panic. Instead, he reportedly smiled. One nurse documented his response. "That's been happening more often lately." When pressed for clarification, he refused to elaborate. He asked for water. Then he asked again what year it was. The hospital's internal report concluded that the incident was caused by a temporary database synchronization failure. Multiple systems failing at once, they said. But this explanation fails under scrutiny. Paper records existed and later disappeared. Staff shift notes referencing the patient were missing from backups. Security access logs showed staff entering the room, but no patient ID associated with that room, which raises a question. How does a system failure erase one person while preserving everything around them? On the third morning, a nurse entered the patient's room to administer medication. The bed was empty. No discharge order, no transfer record, no security alert. His clothes were folded neatly on the chair. The IV line had been removed, cleanly, professionally. Security footage was reviewed. This is where the case becomes disturbing. Cameras showed staff entering and exiting the room, but the patient never captured leaving. Not in hallways, not near exits, not on stairwells. At one point, footage shows a nurse speaking into the room, reacting to someone standing just outside the camera's field of view. But when the nurse exits, the room appears empty, as if the patient just stopped being there. Authorities later suggested the man was a sophisticated identity fraudster, someone skilled enough to avoid databases. But this explanation fails for one reason. Fraudsters want records. They need systems to accept them. This man didn't bypass the system rejected him entirely. Another theory suggested mass misremembering, that staff confused multiple patients, that stress and routine blurred memories. But the consistency of descriptions across departments, shifts, and documentation makes this statistically implausible, and it does not explain missing logs, altered backups, or corrupted biometric data. Weeks later, a janitorial staff member reported finding something strange. Behind a cabinet in the same room, taped to the wall, was a folded hospital wristband. No name, no barcode, just a handwritten note on the inside. 3 words: "I was here." The wristband did not match any known hospital inventory batch, and no one could explain how it got there. If this man existed, where did he go? If he didn't exist, who spoke to the staff? How does systems designed to track reality reject someone entirely? Because somewhere in a hospital that officially treated no such patient, people still remember the man who asked what year it was. And according to every record that matters, he was never there.